Hey guys, Dr. Bodle and welcome back to my channel. In today's video, we're going to cover a topic that I don't think gets talked about enough, which is the fact that people with thyroid problems have a more difficult time processing dietary carbohydrates. So to help you understand how low carb can be a great tool to approach your health with, we're going to cover how thyroid function can influence the hormone insulin, why certain factors in our health can decrease insulin function or insulin sensitivity, and we'll also discuss what carbohydrates are and how we can manage our intake to better improve our health. And as always, I'd appreciate it if you're enjoying the content, if you could give this video a thumbs up, subscribe to the channel, and also ring the bell so you're notified when I post a new video every Thursday morning. My specialty is in helping women with Hashimoto's and low thyroid to lose weight and improve their energy naturally. And one of the key principles that we use in my clinic is understanding that the body works as a whole. And just because we're having issues with our thyroid doesn't mean that we can't have problems downstream from some of those changes. One of the big areas that can be affected by thyroid dysfunction is our insulin signaling pathways. But for us to understand exactly what that means, we need to better define insulin and the way that it works with our cells. Insulin is a hormone. And you can think of hormones as the long-distance messaging system within the body. Each hormone, which is made up of protein, has a specific shape or code. That way, when it eventually reaches its destination, it can tell that cell to perform some sort of action. Insulin's job, or the message that it wants to deliver to the cells, is that they need to increase their uptake of glucose from the bloodstream. It delivers this message by binding with another protein that is located on the surface of the cell, called the insulin receptor. Makes sense, right? Insulin fits to the insulin receptor sort of like a lock and key. And when these bind, it lets the cell know that it should move these gateways or doorways to the surface of the cell, which will then allow glucose to flow from the bloodstream into the interior portion, allowing it to be burned for energy. If there's any excess glucose, insulin will also let the cell know that it needs to be stored, either as glycogen or as fat. So what is insulin's message to the cell? Essentially that we just consumed all these good nutrients and we need to store them away. Use what is necessary to make more energy for yourself, and if there's any left over, put it into a form that we can access later when we don't have as many nutrients available. But here's the thing. When we break down the hormonal process, it sounds pretty simple. Hormone released into the bloodstream, travels along, binds to the cell, message delivered, action occurs. But it's not always that easy. Hormones are not on a predetermined track like a train dropping off a passenger at a specific station. Instead, I think of it more like shooting a basketball into a hoop. Sure, I can set my body and line up my shot, but just because I do that doesn't guarantee the ball is going to go through the net. And the same thing goes for hormones. Just because a hormone is released doesn't mean it's going to arrive at its destination and deliver its message. So if I miss my shot and fail to achieve my goals, what are my options? Well, I'm going to keep on shooting, and our body does the same thing by producing more hormone. Yes, our accuracy goes down, but because there's so many attempts being made, there's a higher likelihood that at least one is going to succeed. But what if that original hoop that we are shooting at is now reduced in size? Now we have two problems. The first one is that our accuracy is low and therefore we have to shoot more shots just to make a few baskets. And the second is that the target is harder to hit. When both of these factors are in play for our hormones, that's what sets the stage for a decrease in insulin sensitivity or insulin resistance. Insulin resistance occurs because we don't have good communication between insulin and our cells. Although I use the analogy of the hoop getting smaller, that's not exactly what happens with our cells, but they do reduce the amount of insulin receptors, and the insulin receptors that are present aren't functioning at the same level as a healthy one. This requires our body to take more shots, so to speak, to make sure that that message is delivered. But there is no free lunch, and maintaining these higher levels of insulin for a long period of time can have detrimental effects on our health. Things like obesity, diabetes, high blood pressure, cardiovascular disease, cancer, and some neurodegenerative conditions have all been associated with high insulin. So you can see why it's something that we'd like to avoid. But what causes our insulin receptors to decrease in function and number in the first place? Because if we can better understand that, then we can go after them, support them, and help us to avoid some of these long-term detrimental health outcomes. Well, it probably won't surprise you that many of these causes are a direct result of our modern lifestyle, including things like being sedentary, smoking, having poor sleep or sleep apnea, being exposed to environmental toxins or pesticides, having excess body weight, or having parents who had excess body weight. But the two big ones, and the ones that we're focusing on today, are low thyroid function and high carbohydrate diets. And while any of these problems that I just listed may be less of an issue in isolation, it's when they all come together that it's more of a challenge for our health. This is one of the big reasons why people living 50 years ago could eat the exact same calories and exercise the exact same amount as someone living in 2021, but have a much lower body weight. So how do we turn our health around? We have to start removing things from our own personal list of stressors. So while I recommend considering all the factors that I listed, using a low-carb approach can be uniquely powerful in terms of improving your health, and it's something that you have direct control over and can make changes with starting today. But before we jump into our last section talking about what carbohydrates are and how we should approach them, let me know in the comments below if you've used a low-carb diet in the past, and also share with me what your experience has been. So what are foods that are primarily made up of carbohydrates? And to help my patients understand this concept, sometimes I like to describe what foods are not made up of carbs. Is it protein like fish, pork, steak, and chicken? No. Is it fat like butter, ghee, tallow, and lard? No. Then it's probably a carbohydrate-based food. This is primarily going to include foods made from plants like grains, breads, pastas, tortillas, cakes, cookies, pies, flours, and fruits and vegetables. And while a food item like a cookie will certainly have more of an impact on our blood glucose and therefore an impact on our insulin than something like broccoli, all of these eventually break down into glucose and will have some sort of an effect. The question becomes, what is your tolerance for carbohydrates? And depending on how long you've had health issues and how many different factors are disrupting your insulin pathways will dictate whether you need to be more or less restrictive with the amount that you consume. So if we ignore some of those sugary treats and only focus on people who are eating fruits and vegetables, there can still be a wide variety in the way we want to approach these things. Some people will be able to tolerate huge amounts of fruits and vegetables and be able to tolerate high starch and high sugar options like mango, pineapple, and banana, or things like sweet potato and squash. Others will have to forego these and instead choose low sugar fruits like avocados, coconut, and berries, and avoid starchy vegetables, instead opting for higher fiber vegetables like asparagus, broccoli, and leafy greens. But the best way to know if you should change the amount of carbohydrates that you're eating is by looking at your energy levels and your weight. If you have changes in energy levels that are directly related to when you eat or when you go too long without eating, then this strongly suggests that you're consuming too many carbohydrates for your body. So if you get symptomatic, if you go too long without eating, developing things like headaches, nausea, and anxiety, and then you feel better after you eat, that's a strong sign that your glucose and your insulin signaling is off. Additionally, if you eat and feel tired afterwards and have a tough time staying awake, this is another indicator that you're eating too many carbohydrates. Lastly, if your weight is steadily increasing, or if you're trying to lose weight and aren't having any success, remember that carbohydrates will increase our insulin levels and put our body into storage mode. When it's in storage mode, we are holding onto those fat cells and we're not breaking them down. Therefore, that will prevent us from losing weight like we want. So to quickly recap, when our insulin pathways aren't working correctly, it can change our metabolism and contribute to long-term disease conditions. One of the big factors that can affect this are things like high carbohydrate diets and low thyroid function. Since we have less control over our thyroid and more control over things like our diet, changing to a low carb approach can really help to reduce the stress on our system, allow our thyroid to function more normally, and allow us to achieve our health goals. If you like today's video and are interested in working with me one-on-one, I always start with a free consultation with my patients to make sure that we're a good fit to work together. You can start that process by sending me an email at contact@seattlethyroidhelp.com. Additionally, one of the big mistakes that I see people make when they go low carb is they forget about their electrolytes. To help you out with that, grab my free download in the description box below, which is Electrolytes for Hashimoto's and Keto, which will give you a recipe you can make at home to make sure that your electrolytes are on point. But that's all for today's video. I hope you guys liked it, and if you did, give it a thumbs up. If you're interested in learning daily tips to help support your thyroid, you can always check me out on social media. My link for my Instagram page is right below here. My name is Dr. Bodle. I hope you guys are having an outstanding week, and I'll see you next Thursday.